Thank you for visiting the channel. I'm Laura, and we're going to talk about something that causes a lot of interest, anxiety, and regrettably a lot of misleading information nowadays. How big is the average penis? And more importantly, how do you measure length and girth correctly, given that more guys are thinking about having their genitalia cosmetically altered? This question keeps popping up in doctors' offices, online discussions, and social media. But before we go deeper, here's something that might surprise you. About 95% of men who stress over their penis size are actually in the normal medical range. That's right, most of the time. It's not a physical issue, but a mental one. Many guys think they're too small because they compare themselves to unrealistic standards, especially from adult films or the internet, where bodies are often exaggerated or even edited. What's also interesting is that men worry about this way more than women, while over half of men say they feel insecure about their size. Only 5 to 10% of women say it's a big deal in a partner. So, relax. My goal here is to teach you the facts, clear up confusion, and most of all, help you feel better in this video. I'll share real science, explain how to measure length and girth properly, go over enhancement options and their risks, and even explore a fun historical fact that might change how you see this topic. First, let's learn the correct way to measure penis size. Now, let's talk about how it's actually done, because this is key to understanding what's normal. There are two main things to look at: length and girth, which means the thickness or distance around the shaft. In scientific research, both the erect and flaccid and stretched methods are used to measure penis length. However, the flaccid stretched length is the most consistent and clinically reliable method, as it closely correlates with erect length. To measure it correctly, first use a measuring tape or ruler, then place it at the pubic bone, which is where the penis meets the body. You may need to gently press into the fat pad to reach the bone. The same procedure applies while erect. Begin at the pubic bone and measure to the tip, maintaining the ruler on top in line with the shaft. 3. Stretch the penis out firmly but not aggressively while it is flaccid, and measure to the tip of the glands on the head. Measurement from the skin or beneath should be avoided, as this adds extra length and produces erroneous results. How to measure girth circumference. Girth is just as important as length and can vary greatly from person to person. To measure, wrap a piece of string or a soft measuring tape around the mid shaft of the penis, keeping it away from the base and tip. 3. Note the number where it meets. You can measure both erect and flaccid for comparison, but most studies use erect girth as the standard. Many men have a tendency to overestimate or underestimate their size because of subpar measurement techniques, or by contrasting themselves with others who are fully erect, which leads to unrealistic expectations for what comes next. Now that we have the ability to measure penis size accurately, let's examine what the science actually says about averages. A large-scale meta-analysis was carried out using data from almost 15,000 men worldwide. This type of study aggregates data from numerous research publications to generate accurate averages. I'll walk you through what the actual scientific data tells us about averages so you can see where the majority of men truly fall. The average length of men, whether measured erect or flaccid and stretched, falls between 10 and 16 centimeters, or roughly 4 to 6 inches, in 6.3 inches, the global average, which is around 13.22 centimeters, or just over 5 inches. If you fall within that range, you are perfectly normal. On the other end of the spectrum, there are medical definitions. When people talk about being average, they're actually comparing themselves to unrealistic standards, especially those they see in adult films, where actors are specifically chosen for their unusual size, and even then angles and editing exaggerate the perception. A micropenis is defined as an erect or stretched length of less than 7.5 centimeters or about 3 inches, while a macropenis, which is extremely rare, is typically considered above 24 centimeters or over 9.5 inches. Keep in mind, however, that these cases are statistical outliers and represent only a tiny fraction of the population. The simple takeaway is that if you fall into one of these ranges, you're in the vast majority. And even if you fall outside of the curve, that doesn't define your masculinity or health desirability. Before we continue, I want to briefly share something important. If you've ever felt frustrated or even embarrassed about how you performed in the bedroom, or if you've noticed changes in your desire, sensitivity, or stamina, you should know that it's not your fault and that you're definitely not alone. It's a quick 7-second method that you can perform at home. It supports what scientists are calling the manhood molecule, a key trigger for arousal, blood flow, and staying power. Simply point your phone's camera at the QR code on the screen or click the pinned comment below this video to watch the brief presentation that explains exactly how it works. Let's move on, because I'll now go over the cosmetic procedures that some men think are safe and what they should absolutely avoid. The topic of penile augmentation operations is one that more and more men are interested in discussing. It's quite reasonable to wonder if there's a way to get smaller or modify your size, but it's crucial to understand the risks and restrictions involved and to keep medical truths apart from marketing hype. Improvement of girth becoming thicker. One of the more popular cosmetic treatments nowadays is hyaluronic acid injection, which is the most talked about technique for achieving girth. Naturally occurring in the body, hyaluronic acid is also used in facial fillers. When injected along the penis shaft, it can temporarily increase its circumference by 2 to 3 centimeters. Depending on the product and the user's metabolism, the effect lasts for 12 to 18 months. Although it is thought to be safer than other substances and is gradually absorbed by the body, not all injectable materials are safe. Some clinics provide industrial-grade silicone or non-absorbable fillers like mama polymethyl methacrylate. According to credible medical organizations, these chemicals are not advised because they can result in serious side effects such as persistent inflammation, hard lumps or nodules, deformity, and irreparable tissue damage. The possibilities for lengthening operations are much more constrained and dangerous when it comes to increasing length. Occasionally, two operations are provided. One is pubic liposuction, which reduces fat around the base of the penis to reveal more of the shaft. This procedure doesn't actually lengthen the penis, but can make it look better. A surgical procedure known as two-suspensory ligament release cuts the ligament that holds the penis near the pubic bone. This can increase the visible length of the penis by 2 to 2.5 centimeters when it is flaccid, but it doesn't lengthen the erect. It may cause instability during intercourse and increase the risk of complications and scar tissue. Crucially, neither the Brazilian Federal Council of Medicine nor the majority of international medical organizations have approved any permanent methods for true penile lengthening. Lastly, it's critical to make clear that penile implants, which are occasionally seen online, are medical devices used to treat erectile dysfunction and are only advised in certain situations, as we will discuss in our final section. In order to tie things up, I'll offer a historical viewpoint that may alter your perception of penis size. I want to leave you with a fascinating historical anecdote that may alter your perspective on the subject. In ancient Greek culture, a smaller penis was actually portrayed as the ideal male body and was regarded as a sign of wisdom, self-control, and rationality. In contrast, large penises were frequently connected to barbarism, a lack of discipline, or even humorous exaggeration. When huge penises did appear in art, They were frequently part of caricatures or depictions of mythological creatures like Priapus, who was literally a fertility deity represented as Grote. Look at sculptures of famous gods and philosophers, for example, and you won't see oversized anatomy. Quali exaggerated. Why is this important? Because it demonstrates how society's perception of masculinity and size changes over time. What is considered ideal in one generation may not be in another, meaning that social pressure rather than biological factors account for a large portion of the stress that people experience today. If you've ever doubted yourself due to what you see online in movies or even locker room jokes, you're not alone. But hopefully, this video has given you a clearer, more